Hi, welcome to my YouTube channel. This is Ben here. Just going to check it's recording a second. Yes, it's recording. Sorry about that. I'm just going to make a video on benzodiazepines and how these drugs work, side effects, and why not to be on them. Basically, benzodiazepines enhance the effect of the neurotransmitter gamma aminobutyric acid GABA at the GABA A receptor, resulting in sedative, hypnotic, sleep-inducing, anxiolytic, anti-anxiety, anticonvulsant, and muscle relaxant properties. Also seen in the applied pharmacy of high doses of many short-acting benzodiazepines are amnesic dissociative actions. These properties make benzodiazepines useful in treating anxiety, insomnia, agitation, seizures, muscle spasms, alcohol withdrawal, and as a pre-medication for medical or dental procedures. Benzodiazepines are categorized as either short, intermediate, or long-acting. Short and intermediate-acting benzodiazepines are preferred for the treatment of insomnia, whilst longer-acting benzos are recommended for the treatment of anxiety. In general, benzodiazepines are safe and effective in the short term, although cognitive impairments and paradoxical effects such as aggression or behavioural disinhibition occasionally occur. A minority react reverse, and contrary to what would normally be expected. For example, a state of panic may worsen considerably following intake of a benzodiazepine. Long-term and controversial due to concerns about adverse psychological and physical effects, increased questioning of effectiveness, and because benzodiazepines are prone to tolerance, physical dependence, and upon cessation of use after long-term use, a withdrawal syndrome. Both short and long-term adverse effects, including an associated roughly 50% increase in the risk of dementia. Didn't know that, but it's true. There is controversy concerning the safety of benzodiazepines in pregnancy. While they are not major teratogens, uncertainty remains as to whether they can cause cleft palate in a small number of babies and whether neurobehavioral effects occur as a result of prenatal exposure. They are known to cause withdrawal symptoms in the newborn. Benzodiazepines can be taken in overdoses and can cause dangerous deep unconsciousness. However, they are much less toxic than their predecessors, the barbiturates, and deaths rarely result when a benzodiazepine is the only drug taken. However, when combined with other central nervous system depressants such as alcohol and opiates, the potential for toxicity and fatal overdoses increases. Benzodiazepines are commonly misused and taken in combination with drugs of abuse. In addition, all benzodiazepines are listed in Beer's list, which is significant in clinical practice. Can be used in panic disorder, generalized anxiety disorder, social anxiety, insomnia, seizures, alcohol withdrawal, anxiety. They are what benzodiazepines can be used in those conditions. There are paradoxical effects, possible cognitive effects, long-term effects are usually seen, and there is a withdrawal syndrome to most people, although some people say that they got off it easily and they had no withdrawal symptoms, but I don't really think that it's that common to get off a benzodiazepine physical dependency with no withdrawal symptoms. You have tolerance, dependence and withdrawal, usually with benzodiazepines, as is usually seen. There's withdrawal symptoms and ways of managing it. Overdose is possible when combined with alcohol or opiates or other central nervous system depressants. There are contradictions with certain other pharmaceutical medications and pharmacology with the different types of benzodiazepines, chemistry, mechanism of action, interactions, the history of benzodiazepines. One benzodiazepine called Valium, which is probably the most heard of, was discovered in 1963 by accident by Hoffmann Roche, I think, in Germany. I'm not sure if I got the name right, but it's something like that. There are interactions, like I was saying, and the history of benzodiazepines, recreational use. These drugs can be used and bought on the street, just like heroin can be. If you know the right people, you can buy it on the street. And veterinary use, these benzodiazepines can be used in dogs that may be scared by things like loud noises, and just to make dogs and cats even chill out. Cats, I'm sure, can be given benzodiazepines in low doses, very, very low doses. Yeah, so I've basically summed up the main points of benzodiazepines. I am on 30 milligrams of diazepam, which is Valium, which is the drug that I was talking about a minute ago or so. And this drug is a long-acting drug. It lasts, its half-life. Half of the drug will stay in my system for between 36 and 200 hours, but it will probably be on the lower end of that, more like 36, because I've got a physical dependency to it, and when you have a physical dependency to a drug, it won't stay in the system for as long as it would if you didn't have a physical dependency, I think. Although I'm not 100% sure on that. This is just what I think. Because if you think about it logically, if you're addicted to something, it's going to leave your system sooner, because you want it, your brain and body wants your next dose sooner. That's how I think of it. And I will come off it one day, I'm sure, before I die, but it's not for sure. I could be a lifer, I could be on diazepam for life. It still, believe it or not, chills me out a little bit after 10 years of taking benzodiazepines every day. Yeah, so it does do some good, but obviously if you take a lot of it, you could end up with kidney damage, you could end up with liver damage. If you combine it with alcohol, you can wake up with no memory whatsoever of what you did the night before. You wouldn't even know where you went if you took enough of it, of diazepam and alcohol together. If you're lucky enough to wake up, that is. You need a tolerance to at least diazepam to drink a lot of alcohol on diazepam. Else you would be a goner, could be a goner, not necessarily would, but you could be. Major contradictions can be seen if you use all three. of the major central nervous system depressants. I know there are barbiturates still out there, but mostly it's benzodiazepines, alcohol, and opiates that cause overdoses in relation to benzodiazepines. Running out of things to say to it. In getting off it, you should contact your doctor, obviously, if you should be on a prescription for this, because it is actually illegal to have a benzodiazepine other than one. I think there's one that's not a drug, that's a Schedule 5 drug. I'm not sure. That's in America. I think it's a Class C drug in England. I know that. Just having to remember all of the stuff in American as well, because in America everything's different. Like, they do schedules of drugs rather than classes, as we do here. And withdrawal of benzodiazepines is a nasty affair, and you should really follow the Ashton manual, which is written by a woman called Heather Ashton, and this manual is basically absolutely brilliant for getting off benzodiazepines, and it's helped many people get off them successfully and not relapse. It basically involves cutting down 10% every 2 weeks, and then holding for 2 weeks, and then do the same again until you get down to a really low dosage. But it involves, say on Xanax, it involves adding diazepam in, taking Xanax away, then basically crossing totally over to diazepam. Valium, diazepam, Valium's the same thing. It involves making it so you're totally on diazepam, but not straight away, although you could do a straight swap, but it just depends how you feel. You could try a straight swap and it would save you time. It all depends on how much of a rush you are to get off diazepam, or Xanax in this case. I just said diazepam because it's what I'm on, and I was thinking of if I was coming off it. And yeah, taper, basically it's 10% a month you taper, but you do it in 2 weeks and then you hold for 2 weeks. The reason for holding is to get your brain and body used to being on the lower dose, hopefully anyway. Hopefully that's enough time for it to recover slightly and be used to the lower dose. A lot of people don't find them getting themselves really bad withdrawal symptoms until they're down to a low dose, such as 5 milligrams of diazepam. And when you start getting down to 5 milligrams of diazepam, you really want to ask your doctor for liquid diazepam. This is a pink liquid, and I've never taken it before, but I would imagine you have a measuring device, like a syringe, and then you pour it onto a spoon and drink it off the spoon. If it's anything like Oromorph, which is, liquid morphine, Oromorph. If it's anything like that, then it would be like I said. What else can I say? Benzodiazepines, sometimes they don't work at all on some people, and sometimes they work brilliantly on other people, and for the middle ground people, they just work normally how they should work. And if you get a really good effect off them, you're really lucky. If you get a medium effect off them, you're like me. I don't get a particularly brilliant effect or a bad effect. They do relax me, even now, 10 years on. I have been on lorazepam, temazepam and diazepam, and I've also taken Xanax, which is alprazolam, Clonopin, which is clonazepam, and Mogadon, which is nitrazepam, Mogadon is a sleeping tablet really, but it's like a cross between diazepam and temazepam. It's actually quite a nice drug. I'm also on Zopiclone, which is like benzodiazepine. It acts in a similar way, a very similar way. It actually acts on the same receptors as alcohol, the identical receptors I think I'm led to believe. Anyway, I'll end this video now because it's getting a bit long. Sorry for droning on, but I hope you like this video. Please like, subscribe to me please. I make videos about prescription medications, radio control cars, music and things like that. Well, things like that could be anything, can it? I'll make videos about a few random things, but subscribe to me anyway. You got nothing to lose and you might like what I will have to say. Hope you can hear that, so my hand was over my mouth then, so you might not have been able to. Anyway, please like, subscribe and comment if you have any questions whatsoever regarding benzodiazepines, the effects, withdrawal, anything to do with it. I mean them. So there's more one benzodiazepine in the family. Okay, thanks for watching and have a nice day. Bye for now.